Okay, hi there. My name is Anthony Hurley and I'm going to be showing a Foley catheter insertion and removal video. So first step is I'd knock, walk into the patient's room, wash my hands, acknowledge the patient. Hi Hines, my name's Anthony, I'm going to be your nurse today, and today I'm going to be inserting a Foley catheter for you. It's been prescribed for you by your doctor because you're having some urinary retention. Have you ever had a catheter inserted before? And he tells me no, so I explain they're going to be sticking a rubber tube up your urethra and it's going to help us drain some urine from you. If you feel any pain or have any questions, feel free to let me know or ask the questions. Can I start by getting your name and date of birth, please? And he tells me his name's Hines Ward and his date of birth is March 8th, 1976. I'm sorry if I got that wrong, Janet. I think that's what it is. And can you tell me, do you have any allergies? And he tells me no. And then I have verified that the provider has put this order in for your catheter, and it's gonna take 10 minutes. So I pull the privacy curtain, and then I'd raise him up to a comfortable working height, and I put the side rail down, and then the bed's flat, and I'm going to put his legs frog-like so that I can work in between the legs. And so I've washed my hands and now I'm donning gloves, non-sterile gloves. I've got my kit on a separate side table. And so what I'm gonna do is I'm gonna pull out the kit and I'm gonna pull from the top, side, side, and I've got these gloves on. So I'm gonna pull this. And in real life, I can't drop my hands below my waist for the sterile field, but obviously I can't do much about that here on the bed, or on this table. So I'm gonna tuck this in between his legs, underneath his legs, tucked under his butt to collect any of the drops. And then I'm gonna pull these wipes. And then I'm gonna grab one at a time, grab penis and wipe from the urethra down. And I do that for all 3 wipes. This wouldn't have gone on the table. This would have gone in the garbage. So grab all the way down, grab all the way down. Okay, disposed. Now I'm gonna grab this from my kit and I'm gonna wash my hands. Got it. Wash my hands. So now I'm gonna pull this down. Again, my hands wouldn't be below my waist. I'm going to pull the sterile gloves and I put them on a table that I wouldn't be breaking sterile field, but there's not much space here, so we're going to pretend this is the table. And I'm going to open them up and I'm going to flap them like that so they don't close over. And then I'm going to grab, without touching the inside, reach for the stars. Just bear with me. Got it. Grab the other one. Not dropping below my waist, reach for the stars. Got it. Now pretend this wasn't there and my hands haven't dropped below my waist. I'm gonna take this part of the kit. I wouldn't have touched that. I would have touched this out here. And then I'm gonna grab, it's easier when you stand. But grab, and I'd fold this over his genital area and his penis would be sticking out through that hole. And I wouldn't have touched his leg or anything like that, so it's the way it's supposed to be. And now I'm gonna get my kit set up. And if I needed to, I could touch the inside of this to maneuver it better. So now, that's not a real touch. So I'm gonna move this to the side, drop this here, open up these betadines, drop them in my kit. Okay. I've got the water, and I note the amount for when I'm doing this so that when I document, I know how much I put in. So let's stick this right here. And then I've got, I'll deal with that later. I've got jelly, not jelly, lubricant sterile lube. Okay. I'm going to remove this blue packaging from the, oh, that wouldn't have happened. In real life, I'd have to start over, but for this, it never touched the outside of that sterile field. Okay, and what I'm going to do, no, can't touch that either. Got the jelly on it, the sterile lube, and place it back in its kit. Okay, and now that I'm ready to make the transfer, make sure know that, I would now take this and I'd move it over to my bed in between my patient's legs, not touching anything, and then drop. Okay, never drop below my hands. Now it's time to break sterile field, so what I'm going to do is I'm going to grab Heinz' penis and I'm going to grab my betadine swab and I'm going to start the urethra and go around and drop. And then we're going to do it again, around to the bottom and drop. And I get the third one here, around and drop. Okay, now I'm going to grab the tip here. Okay, the tip's intact before I insert it. I'm going to have Heinz take a big deep breath in and then bear down like he's going to try and go to the bathroom. So on the count of 3, Heinz, 1, 2, 3, and I'm inserting until I see a flash of urine. Then I'm going to go in another 1 to 2 inches. Okay, it's in far enough. Now I'm going to pinch with this hand. I'm going to inflate right here. Okay, and the balloon is inflated, so I'm going to grab this, move, and give a tug to make sure that it's in place. Okay, and it is. Now the sterile part of my procedure is done. What I'm going to do next is I'm going to alcohol swab his leg. And I'm going to make sure I put it in a place that there's enough slack to where he can move around. So alcohol swabbed his leg there. And then I'm going to place this sticky pad on his leg. And this is going to be a place where we can clamp it. So here it goes. And for purposes, we're going to say this is his leg. So now it's on his leg, pointing down towards him. This is inside his body here. And I'm going to unclip this here. I'm going to unclipping. So it's in his body, unclipped. Now it's clipped in the right way. And now I'm going to attach this green part to a sheet on the bed. So attached to the bed here. And now I'm going to hang this green hook here, or where is it? This white hook here, to a non-movable object on the bed so that it can't be moved and pulled. So I'm hooking it to that. It doesn't move. Okay, so now it's attached to his leg, and I clean up any of the stuff that was on Heinz' leg. And I'd say, Heinz, is there anything else I can do for you? And I'd rip this cloth off his leg. And I'd remove all this. So this is attached to the bed frame. This is all hooked up. Anything else I can do for you, Heinz? You want anything else before I go? It tells me no. Okay, so then I move the side rail back up. And side rails up ×2, bed low and in locked position, bed flat, bed alarm on if indicated, remove privacy curtain and your call lights within reach. And I'd go and then I would document what I just did. And that's it.